Good morning, good afternoon, good evening. This is Norbert Bokur, your global family nutritionist. Today, I want to talk about your rights and responsibilities as you seek the medical determinant of health. As a patient, when you visit the facility when you are ill to seek medical care or attention, you need to know that you have some rights and responsibilities. First of all, you need to know that your health is in your hands and it is your ultimate responsibility to take good care of yourself so that you don't fall sick. That's why in the other video I indicated that the medical determinant of health only take care of 10% of your health needs. So you can imagine about the 90% is supposed to be catered for you within the social determinant of health, which is outside the health facility. And we need to know that anytime you go to the facility, some of the things that you need to take note of. It is your right that when you are admitted and the nurse comes to treat you or to attend to you, whatever drugs that the nurse is giving you or medicine that the nurse is giving you, you need to know what those drugs or medicines are. You have the right to ask. The nurse is supposed to tell you, but if the nurse is not able to educate you on it, you have the right to ask. You have the right to know the nurse who is attending to you, the name of that particular nurse or doctor. In case the person is not able to mention his or her name to you, you have the right to ask, so that in any case that you receive the medication and you are experiencing reactions or whatever, when you are asked who attended to you, then you should be able to mention the person's name. You should be able to know the kind of or the person who treated you or who attended to you as a patient. It is also your right to be able to take the medication or not to take, because you need to know what the medications are about, what your condition is, and what they are treating you, so that you are able to be conversant with the kind of medication you are taking, so that you wouldn't be in the dark. So you need to know that it is your right to be able to know all these things. Another thing too is that it is your right or your responsibility rather, to make sure that you take proper care of yourself and get particularly your nutrition up to date or up to the task, nourishing yourself well. You need to also know that it is your responsibility to take care of your medical bills. Most of the time, when people are admitted at a facility or when they go to seek for medical care, when they give them bills or whatever, they say they don't have money or they are unable to treat them, to pay for it. And because of that, they either have to go and die like that, or they have to suffer the condition like that. Or they think, or some people think that certain things should be done, or the nurses or the doctors should take that bill in their place. No, it is your responsibility to make sure if your insurance is not active, make sure it's active. Though these days the insurance are not working in the facilities, but you need to make it active. And when you go and they are saying that the insurance is not covered with your condition, or your condition is not covered by insurance, you need to be able to have money to buy the necessary drugs or medicine that needs to treat you. You need to be able to foot your medical bills when you are giving bills. You need to be able to have proper care for yourself, eating proper meals while receiving your treatment in the facility. It is also your right, not necessarily when you are admitted, but when you go for CWC, that is Child Welfare Clinic, or antenatal care, you need to know the kind of medications they are giving you, the kind of drugs they are giving you, or they are giving to your child. If a nurse is coming to inject your child with any vaccine or whatever, you need to ask to know if the nurse is not able to educate you on that vaccine or is not able to educate you to understand, it is your right to ask to know the kind of vaccines they are giving to your child. And in the case that your child is having any reactions when you get home with your child, you need to be able to know the particular nurse who attended to you so that you'll be able to make trace when the need be. And it is also your responsibility to be able to seek that medical attention or medical care. And once you are unable to do that, either because of lack of money or whatever, it is not the right of any nurse or whatever to come and care for you in your home or whatever. So that's why you have to take yourself to the facility and to be able to seek that medical treatment that you need to be able to live healthy. And so much of your health or the responsibility on your health is on you, but not on the nurses or doctors. They are there to do their best to be able to help you in case you are ill. But the ultimate care of yourself or your health needs depends on you. And these days, many people are dying, not necessarily because of sickness or whatever. But when people die, we say, oh, it's God. God has given and God has taken. No, it's not true. Most of the deaths that we are experiencing in the facilities some are out of negligence of the nurses or doctors or health workers. We need to know that these people are human beings. And once they are human beings, some, for example, when they're angered by their spouses, their wives, or their husband or children, and they get to the facility and they are giving you treatment, the concentration might not be there. And that's why the patient, will have to be vigilant to be able to ensure that whatever the nurse is doing on you, you are aware. And if you don't understand, ask. Or when you see certain things that are strange, you ask. Don't just keep quiet. You need to ask. Or if your patient cannot, uh, is helpless, you, the caregiver, need to be very vigilant and be around all the time so that anytime the nurse comes to attend or the healthcare provider comes to attend to your patient, you are around. When you see that the person is doing certain things that are strange in a way, you need to ask questions. Most of the time we are afraid and say when we ask questions, they will say we are too known, or they will say they will not attend to our patient or whatever. And because of that, we just keep quiet. No. And many people are dying either out of poverty or out of negligence. Because when you take your patient to the facility and they say there's no medication, or the medications are there but you have to pay for it, and you don't have the money to pay for, you have to just watch your patient to die like that, which is not supposed to be. So that's why we have to take proper responsibility of our health so that anytime we get to the facility, you are the one in charge. The nurses and the doctors are there to assist you with their expertise so that you are able to recover from your illness. But don't just go and leave your patient there, or don't just go and lie down there and say, oh, the nurses and the doctors will do whatever they will do to take care of you. They will do their best, but everything or greater part of your treatment or recovery process depend on you. And so you have to. That's why even when the nurses or the doctors are giving you medication, they will tell you to eat before, because food is very necessary in assisting your recovery rate or process in the health facility when you are admitted. So let's take good care of ourselves and be very responsible in taking care of ourselves so that we'll be able to live long as required. Thank you. Share with others, subscribe, and follow me on Facebook, TikTok, and YouTube. God bless you.